I'd first like to just say that the arguments that I presented were for the purposes of the debate and don't necessarily reflect my own clinical views. So there are several reasons why you could argue that care should not be withdrawn in the first few days. The first reason is because the prognosis after acute stroke is very, very difficult to determine. There's been a lot of work looking at prognostic scales, and none of them can really adequately predict whether somebody is going to die or not. We'll know as clinicians as well that patients can often rally unexpectedly. So I've looked after many patients who've had severe ischemic stroke, who, for example, have got a lot of edema on their scan, whose Glasgow Coma Scales are very low. And we know that as edema settles, Glasgow Coma Scales can often improve, and it can be very difficult to know who is going to rally and who isn't. So that's the first reason. I think also, if you make a decision very early on to withdraw treatment, you're not certain really whether that's what the patient or the family would want. Often a family is in a state of shock. They often don't understand what is being said. They often pick up just fragments of the conversation. And I would argue that to make a life or death decision in that situation, often when a patient can't express their views, is simply incorrect. If you make a decision too early to withdraw care, it may mean that family scattered all over the world, which is often common, can't get to say their final goodbyes to somebody. And we've all had experience of patients who have got family living all over the world, and it takes time for them to travel. And at the time of the acute stroke, if you made a decision simply to withdraw treatment, then you might be denying the family the opportunity to say goodbye. And we know that grief after acute stroke is very complex, and it's often related, that grieving process is often related to how the patient and the family were treated in the aftermath of the acute stroke. And it's essential, I believe, that family have the chance to say goodbye, as that helps with the grieving process. So those are the main reasons that I argued that treatment should never be withdrawn in the first few days.